expert, I would say mental disorders are disorders of thoughts, feelings, emotions. They cause distress and there's impairment of functioning. This impairment of functioning can be you're not able to do your daily routine, you sleep a lot, you do not sleep at all. Everybody can look like an enemy, you can feel helpless, you can feel loss of control. This is a very big range, but most of all is your functioning is reduced. And mental disorders is not like if you have, you're feeling low for 2 days, that is a mental disorder. Mental disorder is diagnosed after a period of 2 weeks of constant impairment of functioning. Depression has come up in a big way in Pakistan. Then substance abuse and post-traumatic stress disorder because of the safety situation, because of terrorism and target killing and everything. PTSD, post-traumatic stress disorder, has also come up in a big way, but most prevalent among men and women mostly, but also in men, it's depression. Trauma is not something that we feel that if there's a bomb blast, that's going to be it's going to lead to PTSD. Trauma is also the day-to-day abuse that a person gets at home, at workplace, a child by a teacher. And trauma has come up in a big way because people are very insensitive to the feelings of others. There is a lot of negativity in the society. And trauma has its roots in the childhood. There's a word called adverse childhood experiences. If a child has adverse childhood experiences in the past, their chances of developing PTSD in the adulthood or later age is a lot. So we are mostly focusing on the adverse childhood experiences. And what we have seen is that if there is marital discontent, the child is also affected. There's marital discontent, it's not only the women, but the men are also very affected by it. In office place, sexual harassment. I have so many clients coming up with sexual harassment problems, PTSD developing as a result of sexual harassment, PTSD developing as a result of marital problem, PTSD developing as a result of sexual abuse, and PTSD later on developing on very small incident because of adverse childhood experiences in the childhood. Therapist, psychiatrist, psychologist, mental health professional, the first thing that they do is develop a liaison with the client. It is called the therapeutic alliance. In therapeutic alliance, the word most important is empathy. We develop empathy with the client. We understand their problems and we don't sympathize with them, but we give them an understanding that we know what you are feeling, with head nods, with small words. So first of all, we develop a therapeutic alliance. And then what we do is we develop a plan of action with them. This plan of action for a psychiatrist can be medication, it can be a therapy like EMDR, it can be cognitive behavioral therapy, solution focused therapy, but this plan is developed along with the client, with the permission of the client. The client is into this plan. But first of all, we work on their daily routine. Their daily routine has to be in such a way that they wake up in the morning, they're able to function. Daily routine has to have some things that increases their release of endorphins. They should go about their professional, their career activities, as well as looking after themselves. If the client is in an abusive environment, we advise the client to get out of the abusive environment. But sometimes they can't. Sometimes it is not possible for them to get out of the abusive environment. So the safe place does not have to be a rehab or anything. The safe place can also be in your mind. There has to be a place in your mind where you feel calmer, where you feel happier. There may be memories, there may be pictures, there may be something. The safe place has to be in your mind. When you learn to relax, when you learn to be calmer, when you learn to be more objective, you see things differently. That's how we operate. We make the person, as we say, we have this alarm center in our brain, which is called the amygdala. Our job is to down-regulate the alarm center or the amygdala and make the person think more with their cerebral cortex and the thinking brain. And that is if the client is feeling less stressed. So the safe place is in your mind. Some people find it difficult to make a safe place in their mind, so we encourage them to do exercise, walk, anything that they enjoy. These things, they make a place safe for you, they decrease your stress, and then you're able to look at your environment more closely, more objectively, and make life easier for yourself. You can be a good listener. That's all you can do. You can be a good listener. And sometimes with psychiatric illness, the person keeps on saying the same thing again and again. You can listen to them, and then maybe think after you have listened to them, then you can introduce some pleasant topic. Okay, let's go out for a walk. Exercise, releasing endorphins is the best thing that you can encourage a person to do. Make them feel important. There is no harm in contacting a mental health professional, a psychologist, psychiatrist. They will just help you out. There is nothing wrong with seeking therapy. You would be surprised the number of people who are coming for therapy, and they're not crazy people. They're very, very intelligent people. The people who come for therapy are not stupid, they are not mad, they are very intelligent, highly functioning, high achievers.